Hi, I'm Dr. Willie Ong. I'm an internist and cardiologist. I made this video to share my experience in our country. Hopefully we can exchange ideas and maybe come up with a solution. Being a cardiologist, I have been treating many young patients with rheumatic heart disease. One such patient I remember is Rodel, age 21 at that time. He had a severe case of rheumatic heart disease. I advised immediate surgery, but with no money, I saw Rodel's condition deteriorate. Try as I may, I can never forget the look in his eyes the last day I saw him. A mixture of sadness and anger was in his eyes, saying, "It is your duty and the government's duty to care for poor people like me." The problem is this. In the Philippines, just like in other developing countries, we have an estimated 3,000 poor patients waiting for heart surgery. But if we really look for these cases, I'm sure there will be much more cases. Many of these patients are young, mostly in their teens to 30s. They suffer from rheumatic heart disease or a congenital heart disease. The problem is the long waiting line for surgery. Most of these cases are lined up at the Philippine Heart Center. The surgical cost of private care is enormous, around 500 to 800,000 pesos. For a charity case, the cost may come down to 150,000 pesos, which is around $3,300. However, this amount is still not reachable for the average person. And even if they had this money, they have to wait several months after getting their next checkup. Many patients just give up and eventually die. The problem with these patients needing surgery has been going on for several decades. I'm not sure if it can be solved in my lifetime because there is no decline in the number of cases. In order to raise money in the Philippines, you can only go to the Philippine Charity Sweepstake Office, which operates the lotto. However, the long waiting line and many people just give up. For our poor patients, even the cost of a 2D echocardiogram is prohibitive. They can't even buy their maintenance medicines, how much more the cost of surgery. Despite these hardships, the Filipino is kind and patient because they do not demand for health care. Actually, there's no pressure for the government to supply their need. In this video, I'm not blaming any single person or institution. I want to look for a solution. If the government can pitch in some money, then that would help a bit. Who knows, maybe other governments and experts may like to help too. But we have to do something. And so I am appealing to my fellow doctors and the public to look into this huge number of poor and sick patients. Do you have a better strategy? Can we talk to these companies who make these heart valves so we can buy it cheaper? To our patients, please share my post and video. Hopefully it will reach the right people both here and abroad. I know people will say that what I am hoping for is a long shot, but I don't believe in impossible. I am praying for a miracle. I have a feeling that people will come and help save these patients. We all know that the longer we wait, more patients will die. These patients are neither nameless nor faceless. Just here in my Facebook page, I get thousands of appeals for help. It's been almost 15 years since I last saw my patient Rodel. I doubt if he is still alive. Yet there is not a time that has passed when I have not thought of him. I'm also thinking of the 3,000 Filipinos in the same situation as Rodel. We cannot just let them die. We have to give them a fighting chance. Thank you for watching. God bless everyone.